Welcome back, Focus Learners. Today, we are diving into a high-yield review of adolescent development. Whether you're prepping for your ATI or NCLEX exams, gearing up for a pediatric clinical rotation, or just wanting to sharpen those nursing skills, you are in the exact right place. We're going to master the physical, emotional, and social changes of this absolutely crucial life stage together. Let's get right into it.
Here's our roadmap for today. We'll be hitting theories and characteristics, physical growth and puberty, psychosocial development, health promotion and safety, common adolescent problems, and then we're wrapping it all up with an NCLEX knowledge check.
All right, Section 1, Theories and Characteristics.
So if you're taking nursing exams, knowing how these three heavy hitters of developmental psychology view the teenager is literally an absolute must. First up, we've got Sigmund Freud. He places the adolescent in the genital stage. This is that final stage of psychosexual development where, self-love kind of dials back and actual altruism develops. Then there's Erik Erikson. His whole focus is on that classic conflict, identity versus role confusion. The teenager is basically constantly asking, who am I, while trying to adapt to their changing body and everyone else's expectations. And finally, Jean Piaget. He points out that adolescents enter the stage of formal operations. Guys, this is a massive cognitive leap. They aren't stuck in concrete thought anymore. They can actually reason logically, abstractly, and they become highly oriented toward problem solving. It's a total game changer.
Moving right along to Section 2, Physical Growth and Puberty.
Okay, so you can't have those massive cognitive shifts without some biological fireworks going off at the exact same time. Ever notice how teenagers can sometimes look a bit, gangly or uncoordinated? Actually, there's a clinical term for that, asynchrony. It's basically why an adolescent might look awkward and long-legged, and it's simply because different body parts are maturing at completely different rates. So as a nurse, when you have a teenage patient who's feeling insecure about their appearance or maybe feeling super clumsy, you can confidently reassure them. Tell them this asynchrony is a completely normal, totally expected part of growing up.
Now, to track all this physical maturation clinically, we use Tanner's Stages of Sexual Maturity, or SMRs. For both boys and girls, these ratings go from Stage 1, which is your prepubertal child, all the way up to Stage 5, which is full adult status. For boys, we're tracking genital and pubic hair development, and for girls, it's breast and pubic hair development. Listen, this is highly testable information for sure, but even more importantly, it's absolutely essential for your clinical assessments to make sure a teen is progressing through puberty on a healthy, expected timeline.
Section 3, Psychosocial Development.
This is where things get really interesting, because we're looking at the internal and social struggles of the teenage mind. Remember Erikson's identity versus role confusion? Well, teenagers are on this intense quest to figure out exactly who they are. And as part of that search, they often lean heavily into their family's values, either totally embracing them or, completely rebelling against them. A great example of this is a bar mitzvah, which is a spiritual rite of passage into adulthood. Traditions and cultural symbols like this, they are incredible anchors. They help stabilize a teenager's group identity during a phase of life where literally everything else feels like it's shifting beneath their feet.
Next up, Section 4, Health Promotion and Safety.
So with all this new independence comes a whole new set of environmental risks. We aren't just talking about reminding them to wear bike helmets anymore. The absolute chief hazard to the adolescent is the automobile. Getting a driver's license is a huge milestone, right? It's practically a modern rite of passage. But the harsh reality we have to face in healthcare is that road and off-road vehicle accidents kill and cripple adolescents at truly alarming rates. That means our nursing interventions have to heavily prioritize education on seatbelts, the massive dangers of distracted driving, and the absolute zero tolerance for driving under the influence.
All right, Section 5, Common Adolescent Problems.
Teens are notoriously vulnerable to high-risk behaviors, so we really need specific clinical tools to spot those who might be quietly struggling. One of the absolute best tools in your nursing toolkit is the PACE interview. It's this fantastic mnemonic to help you distinguish a drug-free teen from one who might be experimenting or at high risk for substance abuse. P is for parents, peers, and pot, so you're asking about their relationships and any exposure to marijuana. A is for alcohol and automobiles, getting into their drinking habits and driving record. C is for cigarettes, and yes, that absolutely includes vaping and smoking history. And finally, E is for education, talking about their attitude and how they're actually performing in school. The big takeaway here? If 2 or more of these PACE letters are problem areas, that adolescent might be at high risk, and you're usually going to need to make a professional referral.
And now, Section 6,
NCLEX Knowledge Check.
We have covered a lot of ground today, and active recall is hands down the best way to make this stick. We've got some high-yield ATI and NCLEX style questions coming up. I want you to pause the explainer when the question pops up, lock in your answer, and then hit play to see how you did. Ready? Here's your first one. A 16-year-old girl complains she is too tall and everyone stares. She confides in the nurse, saying, "I just hate school. Everyone is always staring at me." What is the nurse's best response? Go ahead and pause right now.
Okay, let's see how you did. The best response is, tell me more about how this embarrasses you. Why? Because this brilliantly uses the therapeutic communication technique of reflective listening. It shows you actually understand the teen's feelings and it validates them. You're not just brushing her off with some cliche like, "Oh, don't worry about it." You are actively opening the door for real, meaningful communication.
Next question. Let's test your physiology. Put the physiological events of the female menstrual cycle in the proper order. Your options are ovulation, maturing the egg in the ovary, expulsion of the egg from the uterus, and thickening of the uterine lining. Pause here, think it through, and put those four into the correct sequence.
All right, let's break it down. The correct sequence is number 1, maturing the egg in the ovary. Number 2, the thickening of the uterine lining, basically preparing a warm nest. Number 3 is ovulation, which is when the egg actually escapes from the ovary. And number 4, assuming it isn't fertilized, is the expulsion of the egg and the lining from the uterus, which we know as menstruation. Great job if you nailed that order.
Question 3. We literally just went over this a few minutes ago. According to the high-yield PACE interview mnemonic used for assessing substance abuse risk, what do the C and E stand for? Pause the explainer and see if you can pull it from memory.
And the answer is C stands for cigarettes. This prompts a crucial discussion about their smoking or vaping history. And E stands for education, which opens up a chat about the teen's attitude and performance in school. You know, slipping grades or constantly skipping class can be a massive red flag for other underlying issues, so we always want to ask about it.
Let's pivot to a medication safety question. During the administration of medications, a 17-year-old patient tells the nurse that he has never had that particular pill before. What is the best nursing action? Pause here and really think about your clinical priorities.
The absolute correct action is to check the healthcare provider's written orders to confirm. Look, adolescents often have surprisingly high health literacy when it comes to their own bodies and their care. If any patient, but especially a competent teenager, questions a med, you never, ever just brush it off. You must always stop, verify, and double-check that written order. Safety first every single time.
All right, let's finish up with a critical thinking scenario straight from our source material. A sleepy high schooler eats bacon, eggs, a muffin, and chocolate milk before an exam. She tells the nurse she's worried about her early morning college entrance exams because she's usually sleepy and can't concentrate. She mentions she studies hard the night before and eats this big breakfast to help. What is the appropriate response from the nurse? Pause and synthesize everything you know.
Okay, this one is pretty complex. As a nurse, you definitely want to acknowledge that her protein-rich meal, the eggs and bacon, actually increases amino acids like tyrosine. And tyrosine breaks down into norepinephrine, which physically increases brain alertness. That is fantastic. But here's the critical thinking piece. Is she sacrificing crucial sleep to cram the night before, and that's what's causing the morning sleepiness? Or maybe her rapid teenage growth means we need to look closer at her iron and calcium intake. It's like a puzzle. I'm going to leave you with that provocative thought. How do we as nurses balance praising those good habits while still investigating potential underlying deficits? Thank you so much for joining me on this explainer today. Keep studying hard, stay curious, and I'll catch you in the next one.